going to move on to our final speaker. Last but by no means least, we have Dr. Beran Parry, who's going to tell us how we can maximize our hormonal health for business success. Dr. Parry is a certified natural medicine doctor, nutritional therapist, and dietary expert, as well as being a natural hormone and immunity specialist. She's a specialist health coach, master nutritionist, and functional medicine and genetics consultant with a mission to create well-being and wellness at every level. With a PhD in natural medicine, Dr. Beran is a multi-best-selling Amazon author on health, wellness, and longevity. Over to you, Dr. Parry. This one, just while you get started, while they sort of
Okay, good. Hi, I'll start again. This is better. Firstly, I just want to say what a privilege it is to be here today, especially because it's International Women's Day, and all you wonderful ladies here, to share information together that helps all of us is just a wonderful experience. And also I'd like to thank Ali Mihan for brilliantly creating and organizing this event. Thank you so much. So today we are here as well as women to celebrate our dedication, our strength, and our passion, because that's what being a woman is about. And it's very important to refocus onto these areas. And remember that the reason that you're here today is you're committing to empower yourself as well. And the positive energy that I just feel radiating as I sat in the audience was just incredible, just so wonderful to experience that. So we're recognizing as well that we all work very hard at our businesses or whatever it is that we do for a living, and we use compassion and resilience as women in business to know that it's really at the heart of everything that we do. I'm talking about health and hormonal balance, and that is very much a driving force of how you will perform in business. And we're here also to support each other and to break down barriers. So, without any further ado, I'd like to go to the first slide. Oh, okay, sorry. The right one? All right. I'd like to just start by giving you a bit of background. I was born in South Africa in 1960, and very interestingly, I became a very young mother. So at age 18, I had my son. Just did everything the opposite way around. And because of that, it was a wonderful experience because I became very aware of what it was to be a woman and also all the enormous hormonal changes. And that really stimulated me to start studying at a really young age. I was actually at university doing some work in banking and then doing a postgraduate MBA. However, I was in Stellenbosch, and there was the first integrative health center there created by two amazing doctors, Dr. Clito Saporetti and Dr. Boris Chato, and they really inspired me to study naturopathy, homeopathy, and nutritional science at a very young age in my early 20s. Nevertheless, I continued in my banking career, was headhunted and moved to Europe, but always had as a part-time work and part-time consultancy in nutrition. And then I continued to study. And then something really interesting happened. At age 40, they discovered some thyroid cancer cells when they looked at a tumor that was removed. And that changed my entire life, because then suddenly I had to step back and say, why did this happen? Yes, we know it happened because there was a hormonal imbalance. I was in perimenopause, which we'll speak about in a minute. But really, it happened, I discovered, because I wasn't doing work that I felt completely fulfilled in. Now, I had a wonderful opportunity. I was CEO of a big international consulting firm. I worked with 45 consultants throughout Europe. And to everybody, it seemed like a very successful career. But inside, I wasn't fulfilled. So what did I do? I went back to school. And I restudied nutritional therapy. I got a master's in nutritional work and also in Pilates, in exercise physiology. And then I started to practice full-time as a nutritional therapist at that time. However, what I found happened was that I was actually more interested in the natural medicine side of it. How do we use natural supplements to actually heal the body? And so I started this long process on researching, writing several books, and eventually obtaining my PhD, which is board certified in the US in natural medicine. And the last 10 years I've been living in Spain. I moved from Belgium, where I'd been for 25 years, got divorced, moved to Spain, and started from scratch. So, just like everybody else here. In Belgium, my son still continues our family business there. However, it's entirely him running it. And I started here not knowing anyone, and I was headhunted by a wonderful natural medicine center and clinic in Gibraltar to head up the functional medicine section. So that's a little bit about what I do. Also, several books that helped, obviously, and then to get the PhD. And one of my books here is my dissertation, which was on immunology and natural medicine. Right, 4 main areas in adulthood that we as women have to look at carefully for hormonal balance. Because this is when things start to go awry, things start to get out of balance for all kinds of reasons. So we have premenopause, which is age 35 to 45, and there we find that we start to get with the reproductive hormones, estrogen, progesterone, but also, and this is where some of these health conditions come in, our cortisol, which is related to how we respond to stress, and our insulin, which is related to how our body responds to blood sugar metabolism. These are 2 really important influences that we don't give enough credit to, and we really need to make sure that we are able to understand that there are all these hormones involved, not just the reproductive ones. Perimenopause, age 45 to 55, is where these symptoms worsen, they get stronger. We have more depletion of the reproductive hormones, and we have normally more increase of the cortisol and insulin. So we have to become even more careful, otherwise we have a degeneration of health and well-being on many levels. The menopause is the 2-year period where the cycle finishes, and we are then officially in menopause after those 2 years. And those 2 years can also be emotionally quite tricky, because now this is signifying a big change in our lives. We then move on to postmenopause, and here a big mistake happens. A lot of women think, oh, I'm now in postmenopause, I'm over it all, I'm absolutely fine, I don't have to take any care, I'm just going to continue my life. It's exactly the opposite. Here is when that depletion continues, where certain health conditions can worsen, and it's even more important to take care. So, here are some of the hormones that are influencing us. There are others, but these are the main ones. They are all ones that we've heard of. Some of them, DHEA and testosterone, maybe less, but we'll get into that more, because those also influence how we react and how we respond, and into that more also are really, really as we go to postmenopause. The interesting thing is that there are 3 levels of symptoms, and this is the confusing thing. People think, oh, it's just a bit of hot flush. It's not. It's a lot more than just a hot flush, or hot flash, they say in the US. It's also about our mental symptoms. How are we with our memory, focus, attention to detail? These things are all really important. And then the emotional ones, the depression, the worry, the fear, all these emotions that come up because we're not sure what's happening to our body and our mind. Well, I'm here to tell you that this is a fantastic opportunity to actually get better and feel better than ever before. So that's the exciting thing, if we do this correctly. So how do we do this correctly? And one of the most important things is don't disregard. Don't think, oh, I'll cope with a hot flush. I'll cope with the extra weight. It doesn't feel good, but, I'll just live with it. And I'll go on to work and continue, because that's what happened to me. I just ignored some symptoms that I was having because, well, work was good. Work seemed to be wonderful at that time, at age 40. And then the next thing is I had a big warning. So make sure that doesn't happen to you. And if you have this, find out why. Speak to a practitioner, a functional medicine practitioner, natural medicine practitioner, who knows about how to diagnose correctly where you are in your hormonal journey. Very, very important. Once you know what's going on, make sure that you implement. So I've had so many patients that come and see me, oh, I had this test, but I didn't really know what to do, so I just continued. I took maybe a little herb here and there, but I didn't really get to the bottom of what do I need to do to find the solutions to improving my quality of life now that I'm in peri or menopause. So the choices are quite vast as well, and there are some risks with some of the choices. I normally say you can go natural or you can go chemical. So natural means that we're going to look at it in a way of, let's start with what the underlying problem is, look at it, and then give you natural medicine versions to help you rebalance. The chemical is simply what we know as HRT. Quite often, a medical doctor will simply prescribe that without even testing your hormones. Yes, you probably need some HRT. And then you'll take a chemical which needs to be synthesized by the liver, and then it's metabolized in not the correct way, to be honest. And then you could have some other issues because you're using a chemical to try and balance your hormones. So that's very important. Now, there are different ways to evaluate menopause, and this is where sometimes we don't know a lot about it. Now, as a practicing functional medicine doctor, what I find is that DNA and gut are two really important areas to give us all the knowledge we need to know why these hormones are getting depleted, why we are reacting in a certain way. So with the DNA, we just had, together with my wonderful colleague Karen, yesterday a situation, she's a wonderful nutritional therapist, where we were assessing the hormones, and I said, there's something missing here. And then we looked at the DNA test, and this woman was actually suffering with hidden insulin resistance, which you couldn't tell from a blood test. But what this does, it influences the way in which the hormones behave. So really, really important. The gut is where we manufacture hormones. We also manufacture hormones in the ovaries and in the adrenals. But if the gut is not synthesizing and manufacturing the hormones, the gut problem is actually the cause of the hormone deficiency besides what's happening in the ovaries. So these things have to be considered if you want a really complete picture of what's going on. And that's one of the reasons I became inspired to become a DNA analyst, because then I was able to analyze the DNA and then a gut analyst, because by doing that, you have the complete picture. Without the complete picture, where do we go? We can only guess, and guessing with hormones is not a good idea. Now, the important thing is the diagnostic. So something called the Dutch test. Has anybody heard of the Dutch test? Okay. So the Dutch test is a urine test which is a lot more accurate and a lot more detailed and internally diagnostic in the way that it actually looks at your hormones. With the blood, we just simply see what is the hormone level in your blood, but what happens when the hormone leaves your blood and goes into the tissues
and then has to perform. That's, unfortunately, we cannot tell in the blood. So we have to do a Dutch test, because that will tell us how the hormone is metabolizing in the tissues and therefore how it's performing. So the Dutch test is, in my mind, a vital part of this, and then you need a functional medicine practitioner or doctor to be able to read the results accurately, then see whether you should be doing DNA gut, and then giving you a complete picture of what's going on, and then you're able to take action and really get to a point where you're improving your quality of life in the past. The lifestyle medicine side of things is another part that's absolutely vital. You've got to sort out your nutrition, because if you're eating a lot of sugar and you're insulin resistant, and maybe it's hidden, so you don't know, then it's going to be messing up your hormones and hormone balance and other aspects as well, because then you're going to be putting on weight, your insulin is going to be causing inflammation, and inflammation is the worst thing of AIDS. So the other thing is being able to move the body and to become stress resilient. If those two things are not happening as well, then you've also not cleared the state of total recovery rate. So just some important things, as I said, inflammation and anti-inflammatory lifestyle means the way that you eat has to be anti-inflammatory, the way that you exercise has to be anti-inflammatory, and the natural medicines that you use have to be anti-inflammatory. So one of the things that happened 5 years ago was that I was no longer satisfied with the quality of natural medicine, so we started our own natural medicine manufacturing laboratory in the US and also in Gibraltar. So we make all our own natural medicines now simply because we are absolutely sure of the best quality. And that's wonderful. We ship all over the world, which is a wonderful aspect to the business that people are sure of what they're getting. And don't forget to move. That walk every day, we were just saying earlier, talking about emotions, you need to be able to walk in nature to get emotional balance in the morning. So don't forget to do that, it's really important. So here is the 5-step protocol. Now this protocol has to happen on every level. If you only do 1 or 2, then you're missing out. So once you're diagnosed, you then have a special assessment. Then you start your action protocol. Now that might be natural supplements, vitamins, minerals, herbs, but you can probably include some bioidentical hormonal gels, which is the only way to take hormones if you want to do it safely. And those we will start, and then it's only the beginning, because then we have to make sure that the dosage, the way you're synthesizing the drug is correct. So you then, over a period of 6 to 12 weeks, we do more blood tests, we do more reviewing of symptoms, and then in 3 to 6 months, we're normally ready to say, right, we have a wonderful balance now, and we just need to come back and check every 3 to 6 months to see where you are, perhaps retest if necessary. A lot goes on your symptoms and how you're feeling, as well as the blood tests and urine tests. So here are some ideas of the bioidenticals and the natural herbs. So the natural herbs, you can take, we have a particular one called Happy Hormones, which has all these herbs in it. You can take them individually, but they need to be taken in conjunction with each other. So don't take one and then not the other, or take too much of one or too of the other. You need to know the balance of that. And then the real secret awakening is these bioidentical gels. And the great thing is that those can be, we prefer to only do them very, very minimally and get your own adrenals to produce your own hormones. So to give you an idea, when you start off with this, when I started, I never was regularly at age 47, now 64, so it's been quite a long time. However, the interesting thing is that at the beginning, he was mainly taking HBL gel 3 times a week. However, once your own adrenals are used to make him, because there's no longer any inflammation in your body, I only need personally to do my gel twice a month, 2 days a month, and that's it. The rest of the time, my adrenals are producing the hormones. Now, that everybody's different. Then you only need 3 or 4 days a month. So if you're not reducing rather than increasing or giving you the same dose, from one person to another, it has to be extremely personalized. Okay, now, a lot of what we're talking about is education. So what I would say is there's one big message you've got to go away with: get educated in this area. Now, education, you can come and talk to myself or one of our functional health advisors for 15 minutes, complimentary, and just talk about how you can start going about this. We have 3 people in the audience today that can help you with that: Melissa, Sam, and Karen. Also, we have some educational programs that we offer which really help with this kind of thing. You can get a complete list from one of us today. There are 3 areas. We have something online called the Ageless Metabolic Success Academy. It's a membership club which gives you access to all the different videos about lifestyle medicine, about hormonal balance, and also about natural medicine education. So you can just go and look at all the ebooks online and look at all the information about this. We also have a personalized online hormonal education program which runs for 6 weeks. It's a once-a-week lecture with myself, which is just looking at hormone biology, rebalancing, bioidentical application, and that includes the Dutch test. So you can come and have that 6-week program with us. Or you can actually, if you're thinking of changing career, look at becoming a functional health
practitioner. We have a fully approved and licensed certification course that we run every year. We just started our next one, and that helps people who are who really want to get to know this a lot better for themselves, or maybe think of practicing in the future and starting a new business. So that's the story for today. I've been told I have to stop, but if anyone has any questions, I'd like to just spend a minute going through any questions. Come and see me afterwards or see my colleagues, and we'd love to help. Thank you.
Thank you so much, Beran. Really interesting to close our day talking about hormones and how our bodies are changing and how we can help ourselves to be healthy and happy with maximum wellness for as long as possible.